Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So in today's video, we are going to learn about musculoskeletal CPC practice question. I will discuss one question and further I will be adding the questions and the rationale. You can take your time and you can solve the question. So let's begin. So let's see our first question. A 37-year-old patient was previously treated with an external fixation of grade 3 left tibia fracture. So patient is already being treated for tibia fracture and it was grade 3. So grade 3 refers to open fracture and with a severe soft tissue injury. Okay. So now next what happened? There is now non-union of the left proximal tibia. So patient currently having non-union of left proximal tibia. What is non-union? Non-union refers to within the time frame the broken bone has failed to heal. Okay, so that is when we consider it as non-union. And malunion fracture refers to the bone will get healed within a time frame, but it will heal in a wrong position. Okay, that is when we consider malunion. So now we are talking about non-union. That means the broken bone failed to heal. So for that he is admitted for open reduction of the tibia with bone grafting. So patient requires open reduction of tibia and also requires bone grafting. Approximately 30 gram of cancellous bone was harvested from the iliac crest. So iliac crest, from patient own body, they are taking the bone, they are harvesting the bone, okay, and then they are grafting into the same patient body. So now the fracture site was exposed and the area of non-union was osteomized, cleansed and repositioned. So what after harvesting what they did, they were applied 3 screws and harvested bone graft were packed. So that shows that patient undergone open reduction and internal fixation procedure with bone grafting. Okay, that too autogenous bone grafting or autografting we can say, because the bone was harvested from patient's own iliac crest. So now these are the procedure keywords we got. So now let's see what are the options we have and what is the code description for these options, and let's find out the correct answer. So you can see the option description here. The first code 27724. So you can see repair of non-union or malunion of tibia without graft, with sliding graft, and then with iliac or other graft. So our bone was harvested from iliac crest. So 27724 is the correct answer. Okay. So and if you look into option B 27758 and 59, these two you can eliminate on the basis of these two. If you see open treatment of tibia only, but these code you have to take when it is a acute traumatic fracture. Okay, in our question it was not a acute fracture, it was like already being treated and it is a non-union fracture. Okay, so that's why you have to take the code from this particular series, and based on your bone graft, the correct answer is 27724. Option A is the right choice. Okay, so next I have added one case study and I have also given some time and added rationale. Please take your time and practice the coming up questions. So yes,